The next splint I want to show is the Boxer. That's the ulnar gutter splint. Indication for this would be a 4th or 5th metacarpal fracture. What size do we need? I like to determine it with a 3-inch elastic bandage coming around the 4th and 5th at the PIP joint. Now if your bandage touches all the way around the 4th, 3 inches is fine. If it doesn't touch, you size up to 4-inch. But 3 will be fine for this patient. Okay? The length will be from the end of the 5th, and again, 2 inches distal from the antecubital space. Okay? Getting this measurement. Now I tell again to use elastic bandage. And just don't stretch it. Come to my product, pull up my door, pull it out, and even though you pushed it back in, still measure from the end of the foil. That's where you last cut it. Okay, get my measurement. Okay, push it back into the foil, into the box, bring the door down, fingers out, make sure the red line is gone, reseal. You want to protect the patient from the fiberglass edges here. Just grab the padding, stretch it once, twice. That protects the patient from any abrasive edges, nicely padded here. At the middle of the splint, I open this up, the double-faced tape, and right at the center seam here, I like to just go ahead and cut a little V out, just out of the center seam. 1/2 inch V. Okay. I close this back down. And I'll just snip the middle of that V, just down the middle. That gives both sides are protected. Okay. Pad any bony prominence, which will be the ulnar styloid, and pad between the fingers. So I'm going to loosely pad this over the ulnar styloid, loosely. And I come through here once, and then I rip it off. Maybe 3 to 4 layers of padding just over the ulnar styloid. And then I'll take a smaller piece and just pad between the 4th and 5th fingers. That's all the padding I tend to use. Now again, it's physician's preference if they want to use more padding, but this seems to be fine. A little bit of water. Push that water through the splint, squeeze, and then remove the excess with your towel. Roll it up, squeeze, the dry side of the towel. Do that a second time, and all you're doing here is just removing the excess moisture from the padding, so that's very important. Taking that V and place it right at the tip of the 5th. Okay. Come on down on the ulnar side, given its name, ulnar gutter splint, or sometimes referred to as the Boxer splint, as we said. And just lock in your splint at the wrist again. Capture my splint. Come around through the wedge space. And now just capturing the 4th and 5th only. Just these 2 fingers should be immobilized. Okay, twice around the fingers. Try to keep that as neat as possible. That's why I'm using a 2-inch bandage. Get a much neater wrap through the fingers by using a 2-inch bandage on a smaller extremity. Again, pulling on the splint, relaxing on the patient. Pull, pull, relax and roll. Pull, pull, relax on the patient. Pull on the splint, pull on the splint, relax on the patient. From the center of the splint again, palm your hands only, smooth it out. Now they want to position this patient down to at least 45 degrees of flexion at the MCP joints. Bring them down to at least 45 degrees of flexion. Again, always check with the physician as far as positioning goes. But 45 will be acceptable. at the MCPs, and I could also see the wrist come back to at least 20 degrees of extension. So what you're looking at is the cobra position, 45 to 20, the cobra strike position or intrinsic plus. But 45 would be acceptable. So once you have your position, to maintain this position, I like to use some tape. 1 inch would be great, but if you don't have 1 inch tape, you can take some 2 inch and just strip it down and just place it on the dorsal side of the hand. Come over the fifth, bring that patient down to flexion, and take this piece back off the dorsal side and just pull the patient back into extension. Now, just to maintain that, just take a smaller piece and come around circumferentially just to hold that tape there. Now this holds your position for you. So when you leave the patient alone, they're not going to be playing with it going up and down. But before you discharge the patient, remove the tape because it is circumferential here.